Schizoid Personality Disorder by Rachel Becker and Dima Thabit. Woo! People with schizoid personality disorder are loners. They prefer being alone and usually choose solitary activities. They prize independence and have few close relationships. In addition, they feel confused about how to respond to normal social cues and generally have little to say. They lack any desire for sexual relationships and feel unable to experience pleasure. They come off as dull, indifferent, or emotionally cold. They feel unmotivated and tend to underperform at school or work. Lastly, they consistently play the role of a follower rather than a leader.
Hi.
I thought it was your friend. What are you doing?
Luring.
Oh, it's the tree.
Yeah.
Oh, yeah, it looks really good. Why did you choose the tree?
Oh, it's dead, and you can see all the branches. It's better than the other ones. You can't see it.
Oh, alright.
Yeah.
Do you live really close to it?
Yeah. Just back there to the left.
Oh, right. No, that's really close to the road. Oh, you've got... Oh, yeah, it's gone. Are you going to Rachel's party on Friday?
No, I don't think so.
Well, I don't have anyone to go with. We have to go in pairs. Because it's like, I don't know, boring or something.
No.
Are you busy?
No.
How come you're not coming?
Do you know? Just don't fancy it.
Right. Yeah. Sure. I'll leave you to it then.
Good.
Diagnosing schizoid personality disorder is usually based on an in-depth interview with your doctor about your symptoms as well as your medical and personal history. Your doctor may perform a physical exam to rule out any other conditions that may be causing or contributing to your symptoms. To be diagnosed with schizoid personality disorder, you must meet the criteria spelled out in the Diagnostic and Statistical Manual for Mental Disorders, DSM, published by the American Psychiatric Association. Below are the characteristics.
Here, there's an and. Yeah, don't say them out loud.
For schizoid personality disorder to be diagnosed, doctors may first need to rule out conditions with similar symptoms such as autism or Asperger's syndrome.
In 1908, Eugene Bueller came up with the term schizoid and classified it as a person wanting to use human tendencies to shy away from the outer world and focus upon themselves and their inner worlds. Since 1908, there has been much research and focus upon schizoid personality disorder, and now two passive studies have been established. The first of these is the descriptive psychiatry, which looks at obvious and describable parts in a person's personality. The second is the dynamic psychiatry, which states parts of a person's personality that are not overt and is more mysterious, particularly because people with schizoid personality disorder are secretive, so they tend to hide things about themselves. In 1925, Ernst Kretschmer compiled a list of characteristics of the descriptive psychiatry and divided them into three groups, which are 1. Quietness, reservedness, unsociable, eccentricity, and seriousness. 2. Shyness with feelings, sensitivity, excitability, nervousness, timidity, and a liking for nature and books. 3. Honesty, indifference, silence, kindliness, pliability, and being cold with attitude. As you can probably tell, a person with schizoid personality disorder is likely to be more interested in themselves rather than pose a risk to other people. Kretschmer said that he believed people with this disorder are oversensitive and cold emotionally at the same time, rather than at varying times.
With the skilled and patient therapist, someone with schizoid personality disorder can make significant progress using these three methods: medications, psychotherapy, and group therapy. Medications, there is no specific drug treatment for schizoid personality disorder. However, doctors may prescribe medications to help treat some symptoms as well as associated conditions such as anxiety and depression. For example, the psychological inability to experience pleasure can be treated with bupropion, Wellbutrin, and Zyprexa. This can help with flattened emotions and social problems. Psychotherapy is cognitive behavior therapy that helps you change your beliefs and behaviors that are problems for you. If you have schizoid personality disorder, this type of therapy can help you increase your sensitivity to interpersonal cues and develop social skills.
Now, when I mention solitary activities, though, it is usually of the computer, electrical, take the vacuum cleaner apart and put it back together type. These are not going to be romanticized solitary activities. You're not going to see a schizoid individual walking on the beach in the moonlight. You know, that's way too sensual and sexy for them. They will not have relationships with other people, including immediate family. They don't crave any kind of intimacy with others. Isolation. And I think the quintessential stereotypical example would be, quote, the night watchman. That would be a job that someone with schizoid personality disorder could do quite well and would have no problem performing.